Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about a condition called lens luxation. So lens luxation is a condition on the inside of the eye where the lens, which is the structure which is behind the pupil, the structure that starts developing cataracts both in humans and in animals, starts becoming loose. And that can happen for two reasons. It can be a primary condition, which is usually a genetic condition, or it can be a secondary condition due to some other underlying problem within the eye. And that could be chronic inflammation, that could be glaucoma, that could be a whole different set of reasons. So lens luxation, if it's a primary condition, it's usually a genetic condition. We tend to see that predominantly in terrier breeds. Um, it usually starts at the age of about 4 to 6 years of age. It becomes a little bit less likely the older they get, so it tends to be mostly a young dog problem. Secondary lens luxation is an instability of the lens caused by other chronic diseases in the eye. That can be like I've already mentioned, chronic cataracts, which haven't been treated. It can be a problem which is further back in the eye, which causes a chronic sort of low-grade inflammation and starts breaking down those attachments of the lens. Or it can be primary pressure problems, which can stretch the eye and make the lens go loose. So there's a whole different set of reasons which can cause it. Primary lens luxation tends to be a condition that involves both eyes because it's a genetic condition. Secondary lens luxation is predominantly one eye that's affected if the underlying reason is only within that one eye. Well, usually with primary lens luxation, both eyes are affected, but to a different degree. So one eye has a lens which is completely loose, which is why clients and patients come to see us. And the other side is loose, but not quite as loose as the first side. But it will progress to the same symptoms as the first eye did. Secondary lens luxation can involve both eyes, but it doesn't always have to. So if you have chronic inflammation in both eyes due to untreated cataract, it can involve both eyes. If you've only had pressure problems in one eye or other conditions which led to the lens luxation, which affects one eye but not the other, then it might only affect one eye. So primary lens luxation is a condition we tend to see mostly in terrier breeds. We do also see it in collie breeds and in other breeds. Secondary lens luxation is a condition that can involve any breed. So there's no breed that's immune to this condition. So lens luxation, treatment options depends on how severely affected the eyes. So a lens which isn't in its normal position can cause other problems such as pressure problems, and these pressure problems can make the eye go blind. So if you have a lens luxation and an eye that is blind and most likely painful, the best thing to do is just to remove that eye. If the lens is luxated but the eye can still see, then we tend to recommend either surgery to remove the lens and in some cases try to replace it with a new lens, or we may need to try and physically, if the lens is in the front part of the eye, we may need to physically try and push the lens back into the back of the eye, where it has more space and is less likely to cause pressure problems, right? So it's not an ideal scenario, but it's a less invasive procedure than having to extract the lens surgically. Unfortunately, the success rates of all of these treatment options isn't great. So once you have lens luxation, if you manage to operate them early, success rates are better. If you wait for too long, or in some cases, even if you operate straight away, you can still end up having significant problems, which can, in the worst case scenario, lead to loss of the eye. If surgery is not performed, but the lens is pushed to the back of the eye, or if the lens is in the back of the eye, there's a risk that the lens, which is in the back of the eye, can cause retinal detachment because of sort of chronic irritation in the back of the eye. So it's not ideal to have a loose lens in the back of the eye, and it will likely cause problems within the lifetime of that patient, but sometimes it's delayed by several months, or in some cases even several years. There are two different types of surgical procedure to remove the lens. There's a minimal invasive procedure, so a small incision method to remove the lens. We particularly like to do that in patients who've got very, very soft lenses when they're still quite fresh, in order to minimize trauma to the eye. In some cases, particularly when the lens is extremely hard, we may have to make a large incision surgery where we open up the cornea, remove the lens, and then have to stitch the cornea back together again. So if lens luxation is left untreated, it will likely result in a condition called glaucoma, where we have elevated eye pressure. And although the dog, or cat for that matter, may not seem painful, oftentimes they are. They're just not showing it very well. So it's always very important, even if the lens is luxated and no treatment is performed, to consult a vet who is familiar with eye examinations and eye treatment, in order to make sure that the eye pressure and everything else is under control. So hopefully you found this information useful. If there are any further questions or comments, please feel free to put those in at the bottom. Thank you very much. Bye-bye.